Welcome to September 2025. My name is Robert Tasker and I'm the Editor-in-Chief of Pediatric Critical Care Medicine. Some great articles this month, 4 feature articles, 4 other clinical investigation articles, a PCCM commentary, a PCCM notes, a narrative, and some correspondence. So first, the feature articles. The first one is by Stansky et al., and this is about sepsis-associated acute kidney injury, and the focus is on phenotypes in 1,450 patients collected between 2012 and 2018, and there's an editorial by Dr. Fortenberry. The second article is by Varela et al., and this is about acute bronchiolitis with a focus on infants who are mechanically ventilated and the physiology of airway closure in 12 patients seen 2023 to 2024. And there's an editorial by Drs. Rotter and Straub. The third feature article comes from Hames et al., and this is about extubation failure following congenital heart disease surgery and looking at clinical and risk analytics in 922 patients collected between 2017 and 2020. And there's an editorial by Dr. Chavitz. And then the fourth feature article is by Vasquez Colon et al., and this is about end-of-life course in patients on mechanical circulatory support, 5 centers, 2015 to 2020, looking at the course in 169 deaths out of 838 patients, and the focus is on subspecialty palliative care. And there's an editorial by Dr. Kirsch. The 4 clinical articles. Val Abhaneni et al. Look at thromboprophylaxis in adolescents, 32 PICUs, 2012 to 2022. It's the CHAT Consortium work and looking at thromboprophylaxis with or without mechanical thromboprophylaxis. The second is by Satila et al., and this is looking at children with severe neurological impairment, and it's a secondary analysis of transcribed interviews collected between 2021 and 2023, and looking at collaboration and mutuality between clinicians and family. The third clinical investigation article comes from Shannon et al., short-term outcomes of critically ill patients who are mechanically ventilated, and it's a parent and provider perspective survey of 50 caregivers and 30 faculty. Very interesting. And then the fourth clinical article is by Rodriguez Guerinao, and this is looking at mechanical ventilation practices in neonatal cardiac patients and the evolution in a single center between 2000 and 2020. And that takes me to the PCCM commentary. This comes from Jacques Lacroix. Some of you may have seen the randomized controlled trial result in adults of blood transfusion strategy in patients with severe acute brain injury. Jacques has written a piece about the pediatric response to this. And this piece coincides with a BloodNet meeting this month. PCCM notes. I've written about our strategy for single center retrospective studies with 3 new types of study that we would like to see more of. The PCCM narrative is unique. This is a poem by Dr. Su from China, and it's gone today. I believe this is the first piece that we've had from China. Correspondence. This is all about central or peripheral VA ECMO and septic shock. And we have questions from Dr. Denardo and response from Dr. Totapali. So altogether, a great issue. See you next month. Thank you.